Hi, this is Mark Struthers. We're going to take a clear-eyed look at hospital finances, specifically how medical imaging plays a central role in generating revenue, even though the overall profit margins in healthcare are surprisingly slim. Three major portions are included in this presentation. The first is the gap between revenue and profit in hospitals. The second is how imaging contributes to both direct and indirect revenue. And the third is a financial model based on a typical 300-bed hospital, and we can see how imaging makes an impact on the overall revenues every single day. In a 300-bed hospital, patient care can generate hundreds of millions of dollars each year. Medical imaging alone accounts for 30 to 40% of that total revenue. Tens of millions of dollars flowing through CT, MRI, ultrasound, and the X-ray suites. At first glance, it looks like a gold mine. But here's the reality. Almost every dollar that comes in is already spoken for. Salaries, benefits, equipment leases, service contracts, IT systems, compliance, supplies, and utilities consume 96 to 98% of all revenue, which only leaves 2 to 4% as true net profit for the hospital. In imaging, the paradox is even sharper. A department might generate, let's say, 70 million in revenue, but after covering 65 million in cost, that only generates $5 million in profits. That same slim margin of $5 million comprises 7% of imaging's own revenue, but it can represent 60 to 125% of the hospital's entire net profit. In other words, without imaging, many hospitals would be in the red. Understanding the key financial concepts and sources of revenue in healthcare is essential to grasp how hospitals operate profitably, especially under increasing economic pressures and the regulatory challenges of today. Administrators walk a tightrope. They must keep the hospital solvent while also protecting its mission of patient care. Their view of optimization is less about squeezing every dollar and more about balancing financial sustainability, service quality, and regulatory compliance. In the hospital, revenue is the total income generated from hospital services, while profit is the remaining amount after all expenses are deducted. Differentiating between these helps clarify financial performance and sustainability in healthcare. Hospitals generate money from inpatient care, outpatient services, emergency care, ancillary services like imaging, and other sources such as grants and donations. Each one of these income streams contributes differently to the overall income of the hospital. But remember, revenue is generated by the services the hospital provides and not the donations the hospital receives. Profitability is influenced by operational costs, payer mix, reimbursement rates, patient volume, and the efficiency of service delivery. Managing these factors is key to maintaining the financial health of the hospital. Hospitals with around 300 beds often report annual revenues in the $900 million range and above. That's a big number, but it doesn't tell the whole story. Simply, here's the breakdown. 96 to 98% of hospital revenue goes straight to operating cost, and that leaves just a sliver for profit, reinvestment, or innovation. For context, if we take a look at the tech industry or a retail store, we often see profit margins of 10 to 20%. In healthcare, we operate on a much thinner margin. Despite the complexity of the risks involved, we operate on a 2 to 4% profit margin. Despite high revenues, net profit margins are usually just pennies on the dollar. That means after all expenses, a hospital might retain only $20 to $30 million, and that is a tight margin for an operation of this scale and size. With hospital profit margins constrained to just 2 to 4%, every operational decision carries weight. In this narrow financial window, effective resource management isn't optional. It's essential. Every dollar spent directly supports patient care and sustains the institution. Equally critical is the strategic generation of new patient volume. Without consistent inflow, even the most efficient systems risk stagnation. In this environment, management must act with precision and foresight, balancing cost control with growth strategies to preserve autonomy and uphold care standards. A 300-bed hospital typically generates revenue from various streams such as inpatient care, outpatient services, surgeries, diagnostics, pharmacy sales, and insurance reimbursements. Understanding and projecting these revenue streams accurately is crucial for building a robust financial model and ensuring long-term sustainability. The main costs in a 300-bed hospital include staff salaries, medical supplies, facility maintenance, utilities, administrative expenses, and equipment depreciation. Accurately estimating both fixed and variable costs helps in evaluating profitability and identifying areas where operational efficiencies can be implemented. Financial models for hospitals often analyze metrics like operating margin, EBITDA, net profit, and return on investment. These ratios help stakeholders assess financial health, plan for expansion, and make informed decisions on resource allocation and strategic investments. Let's examine healthcare. We have the emergency department, primary care and internal medicine, surgeries, both cardiac and orthopedics, oncology for radiation therapy and chemoinfusion, and medical imaging as returns on investment or departments that make a return on investment. The problem is that the emergency department, which has hundreds of people coming to it daily, loses money. The primary care department usually makes 5 to 10% interest on their investment. In surgery, we make a little bit more, 15 to 20% or 25% on the ROI, which is return on investment. With oncology, we're at 20 to 30%, but you'll notice the big generator of revenue is medical imaging at 30 to 50% of the return on the investment. Now let's take a look at the major services that a hospital provides, and you'll see that medical imaging is the top generator of revenue at 30 to 50%, and it generates both direct and indirect revenue. Whereas if we take a department like the emergency room, it's at a negative revenue or a very low revenue of up to 5% ROI. In between, we have surgery, primary care, and oncology bringing in different amounts of revenue generated. But the takeaway here is the number one generator of revenue is medical imaging. The hospital is dependent upon the direct revenue that generates out of imaging exams and the indirect revenue that comes from the exams being done, such as in the emergency department, orthopedics, oncology, and primary care all use medical imaging to supplement their services. If we only had to rely on patient care, we'd be in big trouble. In fact, some hospitals are in big trouble, especially those in rural areas, because they primarily rely on patient care. Today, hospitals are increasingly dependent on non-operating revenue to stay solvent. In fact, some not-profit or not-for-profit systems would run at a loss if not for investment income and philanthropy. So we need to take a look at the hospital in a different perspective as a portfolio company. Patient care, it's still the largest slice, but no longer the whole pie. We now include real estate and leasing. We lease office space, retail space, and parking. In some hospitals, the parking makes the most money of all. Investments and endowments, stocks, bonds, and venture capital. Insurance products, provider-sponsored healthcare plans and Medicare Advantage plans make money for the hospital. The hospital also works with pharma and biotech in different ventures, licensing incubators, device development. Research and grants from the National Institute of Health also provide money through sponsored trials. And again, we take a look at the donations and the philanthropy that are made where we have hospital buildings, etc., named after different people that have donated millions and millions of dollars. And finally, if you're at a level 1 education center or a level 1 hospital, we have education and training for healthcare professionals, including graduate medical education funding and tuition revenues that the hospital receives. Now we'll take a look at medical imaging. We'll take a look at its importance and its structure. Imaging is a high volume, high impact department. It generates revenue directly and indirectly, and it deserves strategic attention. Imaging often generates $250 million or more in direct revenue in a 300-bed hospital. That includes billable scans and procedures. Imaging also drives indirect revenue by enabling ER decisions, surgical planning, oncology treatments, and more. It's a catalyst for downstream revenue. Compared to other departments, imaging often contributes the largest share of revenue. It's not just diagnosis, it's financial. Return on investment is high. Imaging delivers strong revenue per square foot and per staff hour. It's lean and productive. Of course, this comes with cost, equipment upgrades, software training, and maintenance, but the revenue impact justifies the investment. Incorporating AI, 3D imaging, and other innovations can enhance diagnostic capabilities and attract more patients, potentially increasing revenues. This image gives us a comparison with other revenue-generating departments, such as surgery, emergency room, primary care, and oncology. You'll notice that we have the return on investment margins, but we also have notes for each, such as medical imaging has high fixed costs, but strong reimbursement and volume, whereas surgery has high revenue, but also high costs for OR time, staff, and implants. The emergency room has high volume, but many visits are under-reimbursed, and the emergency room is a feeder for admissions. Our primary care and internal medicine doctors are essential for patient flow, but they have low reimbursement per visit. In oncology, we get a number of patients, and we have drug markups that can be very profitable, but the costs are volatile in this department. This diagram illustrates some of medical imaging's downstream revenue influence in different hospital departments. As you can see by this progression, studies and financial models suggest that for every dollar of direct revenue generated in medical imaging, $2 to $3 of additional downstream revenue is generated in other departments. Common imaging modalities include X-ray, CT, MR, ultrasound, and nuclear medicine, and each modality serves specific diagnostic needs and varies in complexity and cost. So let's look at imaging modalities like CT, MR, and ultrasound, and each have different throughput and cost profiles. Together, they form the backbone of diagnostic services. Imaging guides diagnosis, treatment planning, and monitoring. It provides critical information that influences patient outcomes and care pathways. Accurate imaging improves early diagnosis, reduces unnecessary procedures, and supports effective treatments, ultimately enhancing patient care and patient satisfaction. Let's get a little more specific. And this section examines how medical imaging contributes to revenue streams in a mid-sized hospital, like a 300-bed hospital, emphasizing procedure volume, billing practices, and payer interactions. Imaging volumes depend on the hospital size and the service offerings. Typically, a 300-bed hospital performs a mix of inpatient, outpatient, and emergency imaging procedures across multiple modalities. Revenue is generated differently across inpatient, outpatient, and emergency settings, with variable reimbursement rates and billing complexities affecting total income. There's a big difference between a walkie-talkie chest x-ray and a cardiac cath in cost, time, and resources. Billing accuracy and effective reimbursement negotiation are crucial. The payer mix, including private insurers, government programs, and self-pay patients, influences revenue and predictability. Each hospital is literally a separate business, even though they might belong to a hospital network. So let's analyze the profit margins and operational costs of imaging departments. It'll help identify financial contributions and areas for improvement within the hospital. As you can see, imaging provides more than 60% of hospital profits. While imaging itself may account for about a quarter of hospital revenue, its ripple effect makes it responsible for over half the hospital's profit. That's why administrators often call radiology the keystone or the engine of hospital finance. Direct imaging revenue is about 25%, indirect 25 to 35%, which totals to 50 to 60% of the hospital revenue. Let's analyze this profit engine a little bit closer. Remember, medical imaging itself generates 30 to 50% of the profit margin. It also indirectly supports oncology and surgery. Oncology gives us a 20 to 30% margin, surgery a 15 to 35% margin on their investment. Our total admissions gives us 25 to 35% of our total revenue collected. Of those, primary care makes up about 5 to 10% of the margin. And the emergency room is a feeder. It's often negative for its return on investment, but imaging converts ED visits into admissions. For hospital medical imaging, 20 to 35% of the hospital revenue is typically generated directly by imaging services, and their margins are 30 to 50% of their operating margin, making it one of the most profitable service lines in the entire hospital. Imaging is often number one or number two revenue line in most hospitals, rivaled only by surgical services. Power dynamic exists between hospital administration and physicians, and that is why many hospitals are now hiring physicians as employees. It's a fascinating point of contention. So let's take a look at this. Radiologists generate enormous financial clinical value, yet administrative power often rests with non-radiologist department heads who are trained in hospital administration or imaging management. The dynamic is shaped by expertise versus authority, revenue versus control, and visibility versus influence. So it's much better when they work together as a team than fight for power in the department. Let's look at that power dynamic within the hierarchy of the hospital. Radiologists have knowledge power. They control the clinical truth of imaging, and their expertise is indispensable, but it's often invisible to both patients and the boards of the hospital. Whereas administrators have structural power. They control the levers of the systems, the budgets, the staffing, the capital allocation, and strategic direction. This creates a mutual dependency between radiologists and administrators. Radiologists have expert power, knowledge, revenue, while administrators have potential power, budgets, authority, and visibility. The healthiest hospitals recognize this as a symbiotic relationship. Radiologists are the engine, administrators are the transmission system. One without the other stalls the machine. We all know that infrastructure costs millions and millions of dollars. Hospital equipment costs millions and millions of dollars. But surprisingly, the biggest cost in all of the hospital is what? Salaries. So I've put a range of salaries in here from the chief of radiology, the medical director, down to the transporter to give you an idea of the salary range for a 300-bed hospital in 2025. Here's a rough breakdown of the cost per imaging department in a hospital of about 300 bed size, from staffing down to accreditation and insurance. You can see that the largest cost, of course, is staffing, which is about $30 million per year. The smallest cost would be accreditation and insurance, which is about $2 million. But we have another cost variables in between, everything from leasing equipment to the HVAC, etc. So our total cost here would be 30, 50, 60, $65 million. If we made $70 million, that means that we'd only have $5 million in profit. Let's see if I'm right. Of course I'm right. I put together the presentation. So what we're looking for here is the costs include equipment purchases, maintenance, staffing, supplies, and overhead, and have to be efficiently managed to get the expenses down as low as possible and maintain profitability. So here is our example that if we made $70 million in imaging revenue, $65 million would go on direct costs, and our profit margin would be $5 million. That $5 million would make up between 60 and 120% of the hospital's profit margin. Profitability varies by modality. For example, MR and CT have higher margins due to demand and reimbursement levels, while X-rays tend to have lower margins. On the other hand, when an X-ray room goes down, you can always supplement it using other X-ray rooms. If you have multiple CTs, you can do the same. But if you have a single scanner down, how much revenue are you losing per hour until that CT gets fixed? Or MRI. The imaging sector faces regulatory challenges and technological advances that both challenge and create opportunities for revenue growth and improved profitability. Evolving policies impact reimbursement rates and compliance requirements, necessitating adaptability to maintain revenue streams. Emerging areas like teleradiology, personalized imaging protocols, and expanded outpatient services offer opportunities to expand revenue and improve patient care. So let's go back to our car metaphor. The driver is whoever controls patient flow and admissions, because that's what determines how hospital beds are filled, how long patients stay, and how revenue cycles turn. Imaging may be the engine, but surgery and medicine are the hands on the wheel, with administration being the GPS to drive it and navigate. Today, we're going to look at how hospitals really run, not just clinically, but financially, and we'll use a dashboard metaphor to make it clear who provides the power, who steers, and who sets the route. Every hospital needs an engine. That engine is medical imaging. It generates between 30 and 50% of return on investment directly and even more indirectly. Without it, the car doesn't move. But an engine alone doesn't decide where to go. Surgery and medicine have their hands on the wheel. They control admissions, patient flow, and bed utilization. They are the drivers. Now, there is another on-ramp for patients other than through admission by surgery or medicine. It is the ER. The emergency room often runs at a loss, but it funnels patients into the system. It's the feeder that keeps the lanes full on the highway. With power steering, you need direction. The role of the administration is to give us direction. They set the route, payer mix, compliance, and long-term strategy. They decide where the car is headed. Now that the dashboard is complete, radiology is the engine, but not the driver. Surgery and medicine steer, and administration sets the route, and ED funnels patients into the highway. Together, this is how the hospital profit engine really runs. Medical imaging plays a vital role in both clinical outcomes and financial performance of a 300-bed hospital. Strategic management of imaging services can positively impact revenue and profitability amid evolving healthcare landscapes. This is Mark Struthers, and I want to thank you for your time and for your attention. Please subscribe to the Mark Struthers channel. We look forward to doing more projects for you about medical imaging and other areas of interest. Again, thank you for your time and your attention.